Hi, I'm Eirk and I want to welcome you to Fitness Integrated Science TV. In today's video, I'd like to show you how weak hip flexor muscles can actually lead to lower back pain as well as alterations in our gait. Now let's first talk about where some of these muscles are located. If we think about the psoas major and the iliacus, these are going to actually cross the hip and attach onto the pelvis as well as the spine. The psoas major attaches into the thoracic and lumbar spine, crosses over the hip joint, and attaches into the lesser trochanter of the hip. The iliacus attaches on the inside of the iliac crest and also crosses to the inside of the hip. The rectus femoris crosses the ASIS on the front of the pelvis, attaches into the knee, and finally the tensor fasciae lata on the outer edge of that iliac crest down into the iliotibial band and out to the lateral condyle of the knee into that iliotibial band track on the knee. So with that being said, it's going to affect those joints. It's going to affect how well we can sit up straight in a chair. It's also going to affect whether or not we can bend and straighten our knee when we're walking through a gait cycle. So if you find that sitting up straight is really uncomfortable, or when you walk you find yourself sort of foot sapping because you have a hard time actually getting your knee to bend and straighten, this might be an indicator that you have weak hip flexor muscles. So I'm going to show you a progressive approach to getting these muscles stronger. Realize that this may take months or even years of practice to do. In my program, Fitness Integrated Science TV, I like to call this the 5-step cycle to muscle maintenance, even though it's definitely not a linear progression. This is a progression that's going to go through a series of steps that you can always go backwards and forwards into. I love to, first of all, notice where my muscles are weak, and this can be indicated by a weakness. Specifically, I'm going to do something and I feel the muscle being weak. You can certainly get tested by a muscle activation technique specialist. You also can notice it due to the lack of range of motion. So let's say that I have a difficult time flexing my hip a lot more on one side than I do on the other. That inability to flex the hip could be an indicator that one or more of the muscles that crosses that axis of that joint may potentially be weak. Either way, what I'm going to tell you to start with is positional, isolated, isometric resistance training. So what I would like to start with is just lowering down onto the ground. That way I'm off my feet, I'm on my back, I'm going to bend one of my knees to bring that lower back into the ground. From here, just flexing into that hip, draw the knee in. So these muscles at the hip are definitely going to be utilized. Now we place our hand on top without pushing, and then we move that knee into the hand, just working on a gentle squeezing of the muscles. Now if you notice that you're having a shaking or a trembling or a cramping, it is way too much resistance. So we're going to hold that here for just a few motions, or minutes rather, and then release it and come right back down. On the second set, we're going to hold this anywhere from 5 to 6 seconds. Again, very, very light, moving my knee into the hand and then release. Now after you've done that 6 to 8 times, you can do the same thing now with an extended knee. You may notice that your range of motion decreases, but now if I really work on getting that knee straight, I can work on those muscles that cross both the hip and the knee. You may not be able to go all the way to 90 degrees. Let's say that this is as far as you go. Well, gravity now becomes your resistance. You're going to work on squeezing that quadricep muscle and engaging the muscle around the knee, also engaging the hip flexor muscles and release. Then lastly, if the leg is still too heavy, you might want to let your leg rest on an object and then just barely raise your leg away from it so that you're really targeting those muscles. Now when you're doing an isometric routine, if you're feeling cramping or shaking, it's too much. You should not be sore from doing isometrics. They should actually feel good. I like to do these anytime as a warm-up, as a cool-down, or anytime that I feel like my muscles have gotten stretched. Now over time, you're going to notice that things will improve as far as strength. So we're ready to move on to what I like to call integrated isometrics, which to me resembles a lot of like the yoga poses that you might see. So if I'm in a quadricep position, I can start off just by lightly pulling my knee isometrically towards my hand, or coming up off the floor and lightly doing the same thing here. This will actually put direct pressure on my hip flexor muscles. If you like, you could even take that one knee off the floor and then just draw it into the chest. Now I'm dealing with actual load coming from the knee itself. You can see I'm flexing my spine at the same time. So we have multiple joints working to accumulate a position, an isometric position. From there, I could go into a lunging position. So as I step one foot forward, I'm extending one knee back or not. I could leave that knee on the floor. And I'm lightly moving my upper body over that leg, trying to get those hip flexors to hold. And I'm going to hold this anywhere from 5 to 6 seconds, squeezing those muscles and then relaxing. Again, anywhere from 5 to 6 second holds. You're doing anywhere from 6 to 10 isometrics at a time. And again, coming back up into that. So I'm just trying to train a position over time, and I'm really working on getting those muscles stronger. If your muscles get stressed, you can drop on back to the isolated isometric. Now eventually, over a period of time, you may be ready to start moving into what I like to call moving, right? Moving is concentric, eccentric contractions, trying to achieve that joint position. Now if you've been working on isometrics, what you may notice is that, oh wow, I can actually go a lot deeper now into my lunge than I could before. This is because I've improved the muscle's ability to contract at a much shorter range doing the isometrics. The isometrics actually give me what's called a carryover effect, and once the body recognizes that that joint is more stable, it will give me more range without a lot of pain or tension. So moving in and out of this is really important, and I'm just very much thinking about contracting my hip flexors. You can see I'm leaning over my leg a little bit, forcing those hip flexors and quadricep muscles to really tighten. I can also do this in a little bit more of an isolated fashion, just by working on holding my balance and just working on a knee lift. So you can see that I'm using muscles that cross the hip. Over time, if I wanted to work on my knee extensor muscles, I could work on doing this with a straight leg. Now this is going to be twice as hard for the hip because now I've got a longer lever, but again, I'm just holding it. And I would invite you to just pause at the top just for a moment to feel those muscles actually contracting both at the hip and at the knee. Now, if that over time starts to feel really good and you're noticing that your lower back pain has dropped and your gait is actually improving from that, you might be ready to start adding load, amplifying this tissue. So let's say that I wanted to use a set of dumbbells. Anytime I grab weight, now my body has to absorb this weight and it becomes new added tension on my muscle. So let's say that I'm going to start off with a basic squat. Now if I'm allowing 2 feet on the floor at the same time, I'm distributing part of my mechanical stress to my other leg. But as I go down into the squat, I'm thinking in my mind about that weak area at the front of my hip as I go down and then back up. As I go at the bottom, I am feeling those muscles contracting. Then I'm using my glutes as well to come all the way back up to standing. Good. I could also go back into that straight-legged position. So for instance, if I'm back at the wall again, this is one thing, but if I add resistance, it's quite another. You might even notice that your range of motion decreases once I add load, but that may be something that I'm willing to sacrifice as I'm working on muscle strength, which is another big component of muscles. Over time with that long lever, wow, it's already difficult just to hold the weight of my leg up. But if I got really good at that, I may be able to add this weight with it at the same time. Very challenging exercise. And over time, that's going to improve that hip flexor region and make sitting feel a lot better. Now the last exercise that I really love to do, we're going to be actually taking some gliding discs and put it underneath the feet. Using the friction of the floor, I have a lot of muscles. I'll just do it on one side. I have a lot of muscles actually now working at the same time. So I'm going to put my foot right here on the disc, and then I'm moving into a plank position. So I have to all the way realize that, oh my gosh, can I hold plank? You may have to drop one knee to the floor if that's too much. Otherwise, I'm going to push my foot into the ground, tighten up into the abdominal muscles. Now when I draw that leg in, I'm going to bring that leg in as close to my chest as possible. So I'm really working on those hip flexors and then putting resistance on it as I finish. So again, drawing it in, I'm getting spinal flexion, hip flexion, I'm working my chest, I'm working my shoulders, a lot of muscles. And then over time I could do something like adding speed. So I'm working on reactivity, trying to get that muscle to fire more quickly on demand. And if I do enough of these reps in a row, I'm also working on that endurance component of the muscle, spending more time under tension, trying to contract over and over. Now, anytime that got stressed, I could go right back to that isolated isometric and reset that muscle. But if we think about our strength training as a gentle, progressive process, we'll have a better chance of these muscles staying strong over the course of a lifetime. Many times people will resort to things like foam rollering and stretching and massage because they think the problem of tightness is actually something that needs to be stretched. But I want to invite you to the idea that tightness a lot of times is an indicator in the body as to what is actually weak. So I hope this helped. If you like this video, make sure to indicate that below and also click the indications bell so that you'll be notified anytime that we put out new content. Also, if you want more information of videos like this, as well as longer routines with hundreds of workout videos, programs, and education, head on over to the link below on Fitness Integrated Science TV. Thanks for watching, and I'll see you on the next video.